In this video, we are going to take you along on the Cosmedicare experience so you're fully informed on what to expect with your journey here at Cosmedicare. In this video, you'll hear from some of our patient care coordinators, maybe one or two of our nurses, and it just tells you step by step what to expect as part of the process here at Cosmedicare.
So I'm Julie, I am the Bariatrics PCC at Cosmedicare. Your first initial inquiry, we prefer to have an email in, procedure of interest, height, weight, any medical conditions, any medications that you take, and also some images attached to that if you can. What will happen then is that will be passed on to our surgical assessment team. Now what they would do is, based on your images, they would suggest surgeons for you, so the most suitable surgeon for your procedure, and also give you a kind of ballpark figure of what to expect from that. From there, we would have one of our PCCs would contact you and get you booked in for a consultation. There is a little £50, it's not a consult fee, it's just to hold your consultation space, and that £50 is refundable if you decide not to go ahead with your procedure, and if you do, then it's redeemable against the cost of your procedure. So the consultations are actually free of charge. We can generally get you in for a consultation within a week or two of your initial inquiry, obviously dependent on surgeon availability. When the PCC contacts you to book your consultation, there are a number of screening questions we go through first of all, and that will kind of determine your suitability for surgery. So I think where we differ from many other places is that we go through all this first of all, so some people don't even manage to get for consultation because they're not suitable, either because of pre-existing medical conditions or we can't meet their expectations for whatever reason.
Hi, I'm Lisa and I'm the team lead here at St Helens in Livingston. The next stage of your patient journey is coming in for a consultation. We have two beautiful hospitals, one based in Livingston and the other based in Glasgow, and a wide range of our surgeons consult at both hospitals. At the inquiry stage, we would certainly find out kind of where you were looking to have that consultation. Typically, our consultations take place on an evening, Mondays, Tuesdays, sometimes Wednesdays and Thursdays as well, so depending on which surgeon you're coming to see, it would typically be an evening. We do sometimes do kind of afternoons, but it really depends on the surgeon's individual diary management and also their NHS commitments. We would welcome you at the front door. We've always got someone on reception to give you that warm welcome. We appreciate that you might be quite nervous and apprehensive, so it's always nice to have a friendly face on the front door. You would take a little seat at reception. You're more than welcome to bring a family member or a partner along with you. I tend to find that's quite nice because during the consultations, if you're comfortable, it's good to have other people thinking of different questions and things as well and different perspectives. You will be called in by the surgeon and you will come into one of our beautiful rooms in the hospital. At that point, you will have a conversation about what you're looking to achieve and why you're there. You will then potentially need to be examined depending on the area you're coming in to discuss, and your patient care coordinator will be in the room present at that point as well. After the examination, you will then have another conversation about the kind of what the examination's brought up, what you're looking to achieve, answer any questions that you have as well, because you might have brought a little list with you and you want to run through these things. The surgeon will discuss kind of risks, he will go through detailed surgical plans and just really, as I say, spend some time answering any questions you've got. Once you're finished with the surgeon and you've got all the information you need, the patient care coordinators are on hand to answer any questions you've got. We may discuss things like dates, costs. We will also go through some 3D scans with you. We have a wonderful app called Cosmedicare, which we tend to generate 3D images for our breast patients. So it's a wonderful tool to be able to show patients what their potential outcomes can be. We will also be able to answer questions about admission times or any concerns that you may have at that point as well. On the night, there's absolutely no obligation to book in for surgery. The consultations are really to get knowledge about procedures and what's right for you. You may have seen our wonderful Facebook pages and thought, oh, that breast surgery is fantastic, but actually that might not be your procedure and your surgical plan. So really the point of the consultations is coming in, building that knowledge and seeing kind of what's right for you and your desired results. So no obligation to book, and certainly the next again day, what we tend to do is send over your images if we've generated some for you, your quote from the surgeon, and we tend to give you a little call because it can be a lot of information, a lot of knowledge that you've been given. Let you rest on that, have a cup of tea, chat with friends and family, and follow up the next again day.
Once you've secured your surgical date and you have agreed the time frame for your surgery with your surgeon and our patient care team, they then get to work arranging your pre-op consultation. Depending on what procedure you're having, your pre-op consultation will either be over the telephone or face-to-face. Most commonly, the face-to-face consultations are for people having gastric sleeves because there's blood that needs to be drawn for this, and it needs to be done in a timely manner prior to your surgery, usually 2 or 3 days beforehand. If you are not having bloods taken, the pre-op consultation is done by our nurses over the telephone, usually about 2 to 3 weeks before your surgery, or sooner if you have a shorter time frame.
So I'm Danny Widdowson, I'm a consultant plastic surgeon here at Cosmedicare. I'm just going to talk to you about what happens on the day of surgery. Thankfully, by the time you get to come into hospital at the day of surgery, all the planning has been done and everything is prepared. So actually that's the final piece in the puzzle, and it should be a relatively stress-free experience because everything's been discussed, you know what to expect. But you basically arrive on the day of surgery, you'll see the surgeon, which may be me. If you see me in the clinic, you'll see an anaesthetist, you'll see a nurse, and we'll just go through some general paperwork. You'll be consented, which you'll already be informed about prior to surgery, and then you'll be marked by the surgeon, and you'll be taken through to the operating theatre, have an anaesthetic of whatever is appropriate and been discussed with the anaesthetist already, have your surgery, and then you wake up. When you wake up, you're then taken into a recovery area, which has got 2 stages. That ranges from anywhere between an hour to 3 hours to even an overnight stay, and then you will go home with instructions from a nurse after having seen the surgeon again to be taken care of at home.
Hello, I'm Gabriella. I am the Group Hospital Manager here at Cosmedicare St Helens, and I'm going to talk to you a wee bit about the post-op experience following your surgery. Now, once you've had your surgical procedure, one of our lovely post-op team will talk to you about what to expect after surgery for your particular procedure. And they'll give you instructions, they'll give you guidelines, and they'll give you medication to take away with you to get you through that first week or so of recovery. Now, when patients are being discharged, we do ask someone to come with you to collect you, to take you home. We wouldn't discharge it on your own, so it means that you've got another set of ears to listen to the post-op information because it's so important, and you've also got someone to get you home safely. Now, when you're at home, we are always on the other end of the phone should you need anything during the entire recovery period. Everyone has such a different experience when it comes to post-op recovery, and there's no way to say how your post-op recovery will go. All we can do is give you all the advice, support and guidance that you may need and be there every step of the way. Now, when you're at home, you will receive a call kind of 1 day post-op, usually within the first 24 to 48 hours, depending on when your procedure is scheduled. And that's with one of our lovely nurses who'll go through everything, make sure that you're totally comfortable, make sure you know what you're doing, and make sure recovery is going well. Now, that being said, we do have an out-of-hours number and an email address, so should you have any concerns at all from the minute you're discharged to your call with the nurse, you can be in touch with us as many times as you like to get that reassurance that you require. Now, when you've had your 1 day call, you will then be called again through that week with the nursing team just to make sure that you're okay, and then you'll come back to see us at the end of the first week. Now, at your first week appointment, that's an in-clinic appointment if you're kind of based locally. For our patients that are further travelled, other alternative arrangements can be made, but generally we like to see you in 1 week post-op, and that's when the nursing team will get your dressing changed if required, they'll check some stitches, and they'll just make sure that you're on the right road to recovery. After that, we take it at your pace. Generally speaking, you come back then at 6 weeks to see the nurse and then 6 months to see the surgeon. However, everyone is so different, as I've said. So if you do require weekly checkups, bi-weekly checkups, if you don't come and see us again then for another 6 months, we take it at your pace and at your recovery, and we're here for every step of the way.
So now you know what to expect, all you need to do is take the next step. For you, all you have to do is make an inquiry. That can be done via our website, via our social media channels, or simply by emailing us at inquiries@cosmedicare.uk. We really look forward to speaking to you and continuing the conversation for wherever you want to be in the future.